All right, welcome everyone. I'm so glad you can join us today. I am joined with the lovely Erin Hazelbaker, and I'm so excited to introduce her to you and the lovely, meaningful work that she does. So Erin is the Director of Functional Medicine at Victress Health and Wellness. She has her master's in physical therapy and has also been passionate about helping others get to the root of their pain or problem. Among her passions include being a birth doula, now just for family, and she's assisted at many births, even one in a car. Oh, I want to hear about that. She was an All-American volleyball player at the University of Dayton, where she met her husband, Brooks. They have 5 children and are currently looking forward to moving into a new home in a new town and joining a new parish. Welcome, Erin.
Hi, it's so great to be here, Rita.
I love that. Okay, we just have to start with the birth in the car.
Sure. Oh my gosh. Yeah. Yeah. So I had a client who actually lived only a mile away from me, which is always incredible when you're doing doula work. And this woman had a previous birth that was a little bit challenging for her, and she kind of the birth ended up coming quickly, but it took a while to kind of get to that like really that transition phase. And so it was like, okay, we're probably going to have some time here before it becomes like, an emergency. Well, she calls me and she says, I think we're at that phase. And I said, wow, really that quick? Okay, let's go, let's get in the car and get there. And her husband's on the phone with me, and I can hear the client start yelling out, the baby's coming. And I'm like, okay, hang up, call 911. I'll be there in a minute. And so I get in my car, run over. She's giving birth in her car. And then the best part of the whole story is, here comes all the paramedics, all the fire, I'm telling her husband, go grab towels, the whole thing. This beautiful baby is born in this car. This woman is in her driveway. She's very, very modest and, kind of like, oh my gosh, I can't believe this is happening, but we've got her all covered up. The baby is gorgeous and just so beautiful. And here's these paramedics who are panicking. It was a riot. They're like, I don't know what to do. They're trying to like read through this list of things like, has the baby been born? Check. Where's the cord? I don't know. It was so funny, so we're kind of like, it's okay, guys. The baby's born. Mommy's fine. Baby's fine. So we had this like just awesome moment with mom, baby, and dad of just like, this happened, and it was amazing and beautiful. And, then also just kind of allowing the paramedics and the firemen to know it's okay. This is birth, and it happens this way sometimes. And so that was one of my favorite experiences as a doula for sure. Yeah.
Oh my gosh, I love that. And what a gift you were to them in that moment, because I'm sure they're already like panicky, right? But then if you like, I can't imagine how I would feel personally if I saw the paramedics freaking out. I'd be like, I know. We shouldn't have done that.
Yeah, no, it was more just like they were like, I've never seen this before. What do we do? It's funny, like all the things that they see, all the time, and all of them, of course, because of course it was like 4 men, who show up, and they're like, wow, birth,
Yeah. Oh my gosh, that's amazing. Oh, I love that so much. Okay, so tell me a little bit about, I guess, kind of the genesis of your practice. Did you always have an interest in functional medicine? How did that, or if not, how did that come about?
Yes. So here's really the rundown of our practice. And I love telling this story too, because what happened is my sister and I are both physical therapists, and we were working in, mainstream healthcare, really just trying to make a difference, one patient at a time, and, doing our best. And what we kept running into is there's a couple of things that kind of kept coming up. First of all, my sister and I both had instances where we knew it was appropriate, or, the patient would desire us to pray with them, or that we kind of needed to talk about something else on a spiritual level with them. Like you could tell there was something bothering them. And really in the places that we were in conventional medicine, in mainstream healthcare, that is a no-no. You have to be really careful with that, because if you step the wrong way, you can be fired. I mean, there's lots of things that we have to kind of be careful of, and it's really just not a part of mainstream healthcare. So my sister said, this is ridiculous. I know what I can do to help these people. If only I'm able to talk about things like confession, if I'm able to talk about the sacraments, if I'm able to talk about forgiveness, on more than just a secular level. And so she decided to start her own practice. And so that became Victress Health and Wellness. And we started out with physical therapy. And then what we saw is that you'd have these patients with chronic pain issues. Maybe they have a history of trauma. Maybe they have a history of, autoimmune conditions. Maybe they have some of these other, broad things going on. And what would happen is we would send them back to their physician and say, I think they need, some labs run, or I think, something else is going on here, besides just this, shoulder pain that migrates into knee pain or back pain. And, their physician would send them back to us and say, oh, labs came back fine. And the patient's just very frustrated and, going, well, I see my labs are fine, but I feel like crap. I just don't feel well. And so that's what kind of got us to dig a little deeper. It's like, there's got to be something else there. And that's what really opened our eyes to functional medicine. And functional medicine really is just trying to figure out root cause. What is happening to the patient that is causing this inflammation, this pain, these symptoms that they're having, that somewhat might be feeling disconnected, like, oh, I have, gut problems. I have, bloating, but I also have depression, but I also have pain, but I also have a history of trauma, et cetera. So that's really functional medicine. What we do with that is we take high level testing. So maybe it's, stool testing. Maybe we do urine testing for looking even just at a cellular level, what's happening. Are your energy producers in your cells working well? Does it look like you're having trouble detoxing? Sometimes we'll do genetic testing. That's kind of more, we can go that route, but a lot of times there's other things we can do to kind of figure things out along the way. So we added in functional medicine. We took our whole practice to go back and get some functional medicine training, and it was phenomenal. It was like night and day. We had these patients that were stuck, and they became unstuck because we took a well-rounded approach and just looked at everything with the patient, and we didn't have to guess anymore. We didn't have to guess, oh, is keto right for you? Or is, plant-based right for you? Or should you be low carb or high carb? We had the results right in front of us to be able to say, okay, this is what's best for this patient. So with functional medicine, we just saw a huge shift. But then we also realized too, that all of us still have a need for conventional medicine too. There's certainly a place for that. There's definitely a place that we should be able to go to get, our blood levels run. We should be somewhere that we could go to, keep an eye on our blood pressure, keep an eye on, cholesterol levels, et cetera. And that's not a great example, but where we can kind of talk about, if we have strep throat or, all just the day in, day out, earaches and colds and, things like that. And what we were finding is that we were having a really difficult time finding primary care physicians that were able to give us or give our patients the time to really dig through and get to the root cause of what's going on. They would go in and they would say, I've had this skin rash, and my functional medicine practitioner thinks it's related to something I'm eating. And the doctor would say, oh, yeah, that's great. Here's your steroid cream, and you're on your way. And so it was like, we're missing that connection. And so we actually added primary care to our practice then at that point as well, so that we could bring that in, train our providers. So our nurse practitioner is trained in functional medicine as well. So she doesn't necessarily practice it, but she has the understanding, that if somebody comes in with a skin rash, yes, I'm going to help them. I'm going to help them on the surface level and say, okay, this is clearly bothering you. You're not able to sleep at night. Yes, we can start with a topical steroid cream. However, we need to figure out what's underlying this. And so we love that aspect of having that primary care in office as well. So long story short, we really just kind of built it around what were our patients needing. And we love the model that we have set up now because what ends up happening is we can avoid sending out to specialist visits. We can keep as much as possible in-house. We pray with our patients. We ask them about how their dog is doing. We know when, somebody's had a family emergency, and we can talk them through it. We can follow up. We can spend 30 to 60 minutes with every visit. So it's just become a model that's like, why isn't all of healthcare like this? And so that's really what we're hoping to do, is kind of transform that as well.
I love that. I love that. So you alluded to a few things about
Sure.
like spiritual trauma, spiritual healing. So
Absolutely.
what role do you think that plays in our health journeys?
Oh my gosh, it
So
has to be a component, right? It has to be, if we have like a tripod, and we lose that spiritual health component of it, I mean, you just can't stand, right? And so we see that a lot with folks that are, suffering and trying their best to go about this in a secular way. I actually was talking with a woman about that the other day. She's like, but I'm doing everything nutritionally well. And, I've got, my exercise is on par. And it's like, yeah, but you're not focusing on this last bit. Where is your prayer life? Like, how is your faith life? Have you worked through some forgiveness? And so you may say, some people from the secular side may say, oh, well, that's just mental health. And it's like, yeah, that's great, but that's only a small piece of that. We are made to be in God's image. We are made to be creatures of the Lord. And so when we try to ignore that and push that to the side, that's where we'll see some challenges too. And I think the other part of it too is really just understanding, suffering, and kind of having that be a piece of what we do as well. Because some of our folks have been through incredible trauma. Some of our folks are going through really difficult times. And so we're not telling them, oh, you should just forgive and move on. It's like, no, we have to hold their hand as they're walking through this time as well. So, so I think that's where that spiritual component really comes into play. Forgiveness. My goodness, we talk about this all the time. There's a study that was done that, if you are able to practice this simple act of forgiveness, and I say simple, that's air quotes simple, but if you're able to practice the act of forgiveness, you can erase the effects of a lifetime worth of stress on your body. Okay. So taking that forgiveness aspect and bringing that into what you're doing on a daily basis. And I'm telling you, it's a daily basis. There's a lot of people, and sometimes it might even be an hourly basis or a minute to minute basis, even applying that forgiveness to, whatever situation you're in. I forgive my kids for acting like crazy people while we're out in public, which caused me to then have a reaction that was inappropriate. So again, kind of bringing it back to yourself too. I know I shouldn't have had that reaction, and I'm sorry for that. But I also forgive my kids who are acting like crazy kids right now. So yeah,
for sure. I love that so much. That's so good. And it's such an important thing when we're looking at stress or talking about our stress load, our allostatic stress load. And something that I think oftentimes we miss, right? Like we look at like, oh, well, my job's stressful, or, whatever it is, I ate poorly, so that was stressful, or I didn't sleep well. And sometimes we look at these factors and we say, there's nothing I can do to reduce my stress. And yet there's this entirely other place that we can go when we're talking about your stress load that is entirely in your hands, right? Like we are the ones that are choosing to hold on to that unforgiveness or to let that go. And that can make such an impact on the stress load that we're carrying. It's so beautiful. I love that.
Oh my gosh, absolutely. I think a lot of times, when people, sometimes they think like, oh, well, Rita, you've got it all together. Like, that's why stress doesn't bother you, or Erin, you've got it all together. And that's why stress, whatever. And then, so it's really important that we kind of share even like, what we're going through, at different phases. And so I share a lot of times, our family story, and even, kind of what we're currently going through. Currently our family I have 5 kids. I know Rita kind of mentioned that before. My sister and I run, the business, and we're growing, and it's beautiful, and we love, the growth that's come about from this. And we sold our home, and we are essentially houseless right now. I don't say homeless because we have so many families that have been helping us to, so much of our family that's been helping us to kind of have a place to be. But we don't get into our new home for another, I think, 28 days. And so with 5 kids and homeschooling and running a business, like, I understand what stress is. I understand, how that can be challenging. And I also understand that I can see it in myself on a daily basis when I don't take the time to have quiet mental prayer, when I don't take the time to have 10 minutes to myself before the kids wake up or at nap time or, whatever, to calm my brain down, connect with the Lord. Lord, where do you need me right now? I am feeling all over the place. I am scatterbrained. I am, a mess. Where do you need me? What can I do to kind of connect? And so I think it's important that we kind of share that a little bit as well. So it's not like I'm just saying like, oh, stress, it's just let it go. We understand it's life. You can't just, say goodbye, family. I'm going to go on vacation. It's like, what can you do in this moment?
Right. Yeah. Oh, that's so beautiful. So good. Yeah. And then just being able to manage that the best we can. Right.
Sure. Exactly. Right.
Yeah, that's so good. So, something that I talk to women about a lot is miscarriage. And especially in this time of, kind of post COVID, post some of the vaccine frenzy, and whether you're pro vaccine or not, I don't think is anything we really need to necessarily get into, but I'm just curious what you're seeing with miscarriages, and if you when you have somebody come to you that's been experiencing miscarriage or several miscarriages, what are some of those things that you're thinking of? Your functional medicine perspective is so beautiful, unique, and different, right? So
yeah,
I'm just curious, what are some of the things you're thinking of if you're talking to a woman that's experienced several miscarriages?
First of all, it's just so heartbreaking, when you experience a miscarriage. And so first is, again, just talking to them about, suffering and forgiveness and it's like forgiving even God, why is this happening to me? And just saying it's so important that we maintain that connection with the Lord and not just like shy away from that because you've experienced this trauma. So that's one pillar of it. The other pillar of it, and this is where my brain just starts spinning because it depends on the person, right? But what we need to do is focus on building you so that your body can maintain and sustain this pregnancy, right? So what we know is that there is so much correlation between gut health and hormonal health. Okay. So we have to get a firm foundation going, gut health. Then we also know that when we have inflammation going on throughout our body, so if you've got, kind of this random pain that pops up or, maybe some autoimmune type conditions, things like that, we have to get that calmed down so our body can focus on its number one job once you become pregnant, which is sustaining that beautiful pregnancy. Not to mention, making sure that we are eating the right things, leading up to that pregnancy, that we are, allowing our bodies to be as strong as possible to help build that. So what a lot of times we'll get into is more just like that fueling, and what else can we be doing to kind of set our gut up for the right place. We also know, and this is regardless of whether you took the vaccine or not, we also know that COVID vaccine or COVID itself, it has a significant impact on gut health. Okay, so we have to be addressing that. So we can't just ignore, oh yeah, I did have COVID a couple, whatever, it wasn't that big of a deal. It still was a big deal on your gut health, which is really interesting. We're just kind of still learning more about that. Is it just COVID that's causing that, or is it COVID that was such a big mess that causes us to realize that more? Are there other various viruses that kind of have that same effect? we're learning, we're kind of trying to dig into all that. So I think it's so important, Rita, that as we're talking with clients that have been through multiple miscarriages, that we're continuing to utilize conventional medicine as well. Absolutely. Making sure that our hormone levels are appropriate and making sure that we're doing everything that we can, from a functional medicine side of things. Our nutrition is on par. I always am challenged because what we're learning is that nutrition is so personalized. Now, there are some general rules that we can make, some general across the board, recommendations. And Rita knows this. She's so fantastic with this. Across the board, women who are either trying to conceive, pregnant, or postpartum need to boost their protein intake. It's just where we need to be. Your body needs that. But what I get frustrated with is the CDC says everybody should be Mediterranean, that's like across the board. It's just like, oh, Mediterranean. Yes, everybody should be Mediterranean. It's like, okay, that's great. And if you're autoimmune, you might really struggle with some of the things that are presented in Mediterranean diet, so we need to be cautious with that. Or, we'll hear about these fads like, keto or carnivore. And it's like, oh, well, that works for, so-and-so. So it should definitely work for me. And that'll help me lose some weight and, all blah, blah, blah. And it's like, we have to figure out what's best for that person. And that's where Rita is so helpful. And where we love to make connections with folks like Rita, who are able to kind of help somebody to really navigate that and figure out, okay, what is best for this person? It's not what the CDC says, blanket across the board. We know that has to be more personalized.
Yeah, definitely. Oh, that's beautiful. I love that so much and so helpful. So aside then from, or maybe in addition to, what else, what are some other things that we can do as women to support optimal hormone health, whether we're trying to optimize fertility or just optimize,
Sure.
how we're feeling throughout the day?
Yeah. I mean, number one place to start, first of all, we always talk about gut. We talk about gut health. And so what does that mean? So somebody will say, oh, but I'm fine. Maybe if they don't have like bloating or if they don't have stomach pain or they don't have, diarrhea, we still talk about, how often are you having bowel movements? I just read a study this morning and it kind of reiterated a study that we had read previously that Parkinson's, one of the first signs of Parkinson's can be slow motility or constipation. Okay. Wow. And so the gut bacteria that gets built up inappropriately in somebody that has constipation like symptoms can eventually lead you down the road of becoming, having Parkinson's like symptoms. So I think it's so important that we're having that discussion with our providers as well. And that's one area that if I could shout it from the rooftops, I would. We need to know how often you're going. And it's not okay to say, oh yeah, I'm regular. What regular for you means once a week. That is constipated. You might be regular every Monday morning, you have a bowel movement, but if you are not having a bowel movement Tuesday, Wednesday, Thursday, Friday, that we need to be having that discussion. Are we able to increase that frequency? So the other part of that too is, along with gut health, we really will struggle with making an impact with someone if they have elevated cortisol levels, if they are not able to appropriately handle the stress that's involved in their life. Okay. If we've done all the right things, we've got them on the correct diet, we've fixed, their gut. We've removed some things that might be harmful for them. In some folks, it's gluten and dairy. I know for me, that's what it is. I really struggle. Constipation will become an issue with me. Bloating becomes an issue with me. My skin just is not as nice if I add gluten and dairy back into my diet. So, we've removed the right things. And if stress or your inability to handle the stress that's in your life is still an issue and your cortisol is still elevated, we cannot support good repair work in your gut. And it's the same, we love to share this story and I heard it on a podcast, and I'm like, I am stealing that. That is the best analogy that I've ever heard. We talk about, with gut health, with thyroid, with hormones. Imagine that you're standing at your kitchen sink and you're washing the dishes, and you're like, wow, I've really got to get these dishes done. We've got a mountain of dishes, going on right now. I've got to get these dishes done. And your husband comes through the door and he says, stop, Erin, stop what you're doing. There's a burglar and he's trying to get in the house. Help me. We got to lock the doors. Call the police. And you're like, no, sorry, husband. I actually need to finish doing these dishes over, because that's really important right now. I need to get these dishes done. And if you think about that, that's so similar to what your body's going through when it's like, going through reparative phases, with our thyroid. If our thyroid, that's low man on the totem pole, when your body is being told that there's a fire over here and there's a fire over here and there's a fire over there, throughout your body, right? So if we aren't able to appropriately maintain, our cortisol levels and our stress management, and if we're not, doing the right things for our gut and fueling our body in the correct way, and we continue to eat things that are, going to be problematic for us, then our body is going to have a really hard time regulating hormones, taking care of our thyroid, et cetera. Does that make sense? So, a lot of times people come to us and they'll say, oh, I just don't have, libido anymore, or, things like that. It's like, well, how can you enjoy, anything that's going on when your whole body has fires that it's trying to put out elsewhere? Of course that's hard for you, So yeah.
For sure. 100%. I love that. And I use the analogy a lot with my clients too. Like, if your body thinks you're running from a bear, it's not thinking about how do we grow another human, right? It's like,
Exactly.
Protect. That cannot happen right now.
Exactly. I love that, Rita. Yeah, that's very similar to the way that we talk with our clients. And I think it's just so important. And, the thing is, some folks are able to conceive and they just, it's just easy for them. And other folks, what we're learning is that, as humans are evolving, it is becoming more challenging for some folks. And a lot of that is because of what we have in our food now. It's because of what's in our water. It's because of what, we're exposed to on as far as toxins and things like that. Our bodies never had to deal with this before. And so it makes sense that some of us will need to detoxify and get rid of the environmental toxins. They'll need to, have a good, healthy, and appropriate place. And the thing is, even if, you are really challenged with this, and even if your body requires all these things to conceive, what are you out? All you've done is make your body healthier so that you can live well, as long as you're alive. And that's really our focus at Victress. It's like, we know that God has us here for a specific purpose. We don't always know what that is. Some days I'm like, okay, God, where do you need me? But it's also so important that I am able to live well as long as I'm alive. And so for me, that might mean that I don't get to enjoy the cookies and cake that my kids do, or that, my family does. I need to remove that from my life. That's a small sacrifice for me to be able to be around and be able to enjoy my children, my grandchildren, my great-grandchildren, et cetera. Live well as long as you're alive.
I love that so much, Erin. That's so good. And I think too, as we, oftentimes those of us that are on this end of the conversation have had our own experience of going through our own life, living less than ideally, with brain fog and feeling unwell. And then when you start to feel better, you realize that it's actually those sacrifices that initially felt so big no longer feel quite as big, because we now have the energy we can point to. We have the clarity of thought, right? We have the refinement of mission, right? Even though sometimes the Lord doesn't give us that quite as forthrightly as we would like, we still have this ability to live our life at a level that before we couldn't have imagined. And that's something that I think those of us, again, that are on this side of the conversation are so passionate about helping others to get to, because we are just able to live more fully alive, right? Would you say?
Oh my gosh, absolutely. And I think just kind of as we apply, in our own lives, that is exactly the reason, most of the practitioners that we've run into that move from conventional medicine. So like what we would call ourselves as physical therapists, more on the conventional medicine side of the spectrum. So whether, we run into physical therapists or nurse practitioners or physicians or, anybody that's moved over to this functional medicine side of the spectrum has had some interaction, either among themselves or, a family member that's like, oh, sorry, we can't help you anymore. Or, you've hit the end of the road with treatment or whatever. And then they are able to kind of dig in and figure out, oh my gosh, there's this whole other angle over here. And why are we not hitting this? And why haven't I learned about this? And then you go back and you learn about it and you're like, oh my gosh, this is so helpful. This can help so many of my patients. This can help me. This can help my mom. This can, and so it's so beautiful because it's okay that we continue to learn. It's okay that we do things a little bit different. I think the other part that we really love at Victress is we try to do our best to make sure that anything that we do or anything that we recommend is not going to be spiritually harmful. We really want to make sure that anything that we're, talking about or bringing to people is something that the church is okay with and the church would approve. So I think that's something that is important for us to remember too. It's not get well at all costs, right? Because certainly Satan could play a role in that, and that's something that we are really cautious of. Do we believe in miracles? Absolutely. Are we asking for one all the time? Absolutely not. What we're asking for is, okay, God, help us to lay out a plan that is along your will that will allow us to help these people as much as possible.
Yeah, definitely. So what are some of those things, if you have a succinct list that we should definitely always avoid, what are some of those things that that would be helpful for those watching?
Yeah, that's a great question.
Probably running the other direction.
Yeah, that's a great question. So, I think one of the things that we are really cautious of and again, we're still learning, but things that we're really cautious of is anything with like an Eastern origin is something that we're cautious of, and we're cautiously, kind of following the church. We're also cautiously following the science on, because the church has been so fantastic. When you go back and you look, we are understanding that the church is, and, our faith has been so right on so many things. Look at how we do with fast. Look at how we do with forgiveness and prayer, and how our body is designed to be worked out. So anything that kind of falls outside of that. So one example that we give a lot is acupuncture, and the reason is because of the origins of what they're saying. So what they're saying in acupuncture, now, can it be helpful sometimes? Yes. Now let me explain why in a moment. But acupuncture is based in the Eastern thought that you have different origins in areas of your body that sometimes need to be connected together. Now, I am not an expert in acupuncture at all, so forgive me if I use the wrong example. But what they'll try to do is they'll try to get different areas of your body connecting and working together. Like, for example, they may put a small needle here and say, oh well, that's supposed to get your whole body working well together because that's your spleen point, or here's your liver point, or here's your whatever. And so what we understand is that, does acupuncture sometimes help folks? Yes. The reason we think now has to do more with the fascia being manipulated. So you may be better off doing something like a dry needling approach, or more of a massage approach even, than the acupuncture, because by putting a needle here, and again, I don't remember exactly where the liver point is. I'm not an expert in this at all. But by putting a needle here, are we necessarily clearing your liver? No. But what we are doing is we're allowing your fascia to be manipulated. And again, we're learning more about this. This is the newest theory, is that is why it's working, is that your fascia is a layer underneath your skin. And when fascia is tight in places, then what can happen is you can develop restrictions in your body. And when we allow that fascia to be manipulated and move more freely, then your body can feel much better. But acupuncture is one that we're just cautious with because, again, they're talking about, various things that are not appropriate in our faith, and again, kind of healing your inner God, rather than, the idea that there is something way bigger than me, something way bigger than what, I am, a part of. I am a part of God, God, I am not my own God. And so we're really cautious with that. We're cautious with yoga similarly, because it's like, okay, we're doing these poses for a specific reason. They were meant to be poses that would praise individual gods, rather than just stretching and feeling better. And, can stretching be fantastic? Yes. Are there other ways of doing it that would be more of a Catholic focus? Absolutely. And so that's what I would encourage you to seek out. There's multiple ways that we can go about this to have a really great focus. So it's really interesting. It's like, there's still, we're still finding the science behind each thing, and why is this helpful and why is this working? And we're able to kind of meld that together from a Catholic perspective too. Yeah.
Yeah. Oh, that's beautiful. I love that. All right. So Erin, how can people work with you or find you?
Yeah, thanks for asking that. We are at victresshealth.com. And so I just encourage you to kind of check out our website and, see what you think. We have, again, that direct primary care. So if you're within, we have people that come from 2 hours away to seek out our care, like an hour and a half, 2 hours away, to have us be, your primary care team. Now, that wouldn't be me. That would be with our nurse practitioner. But you would be able to have her as your primary care team with your family, taking care of those blood work, those, day-to-day problems that you're having. Our functional medicine team is nationwide. And so, we can see anybody telehealth wise. And so, I just encourage you to check out that page as well on victresshealth.com. And if you just aren't sure even where to start, a lot of times we'll just have people call in and we'll do a free consultation. So it's victresshealth.com/free consult. And you just click on the link there and you can schedule a time to chat with me. And we'll have about 30 minutes to kind of figure out, okay, what might be the next best step for you? Is it us? Is it, is it Rita? Is it, hey, listen, just go to the doctor and get these labs run. And so, a lot of times we'll just kind of talk through those kind of things together. We are so passionate about just spreading the message of health and wellness, and that there is an appropriate way to do it, and that there is an alternative if you've been told, oh, everything looks fine, but you still don't feel well. So please don't hesitate to reach out and click that free consult link, and we'll be happy to chat. And just like I said, figure out, are we the best bet for you? Is there something else that might be better?
Yeah. Oh, that's amazing. Thank you so much for your time today, Erin. This has been wonderful.
Thanks, Rita.